This is my presentation on patient access to electronic health records by Debbie Gittens. What are electronic health records? Electronic health records are patient charts in a digital format. They allow important patient information to be stored, updated, and shared by healthcare and benefit providers. They can include the patient's complete medical history, immunization records, allergies, past and present diagnoses, treatments the patient has received, laboratory and test results, X-ray results, and past and current medications. I would like to defend the statement patients should have real-time access to all information in their health records, including narrative notes. Having real-time access to one's health records encourages patient engagement, increases patient satisfaction, and improves care coordination. Regulatory guidelines that have been important in safeguarding patients' access to their health information includes the following. The Health Insurance Portability and Accountability Act of 1996, also known as HIPAA, mandates that all patients have a right to access and inspect privately stored medical information. In 2009, President Obama signed into law the American Recovery and Reinvestment Act, which was a stimulus package whose objective was to invest in infrastructure, which included information technology in healthcare. It led to the enactment of the HITECH Act, the Health Information Technology for Economic and Clinical Health Act, which promoted the adoption and meaningful use of health information technology. Centers of Medicare and Medicaid Services Meaningful Use Guidelines requires that patients be provided with summaries of their medical information after a visit to a healthcare facility or provider. The Meaningful Use program has prompted more providers to implement patient portals to access more such information as appointments and lab results. Some of the pros and cons associated with patients' access to EHR includes increased quality of care, increased patient satisfaction, increased education regarding illnesses and disease processes, and the ability for shared decision-making. The cons are patients' decreased knowledge and understanding of medical data, and the ability to maintain security and privacy. Some of the benefits associated with patients' access to their health information includes patient engagement again, the ability to send and receive messages versus making in-person office visits, decreased time wasted making phone calls and having to wait sometimes greater than 24 hours to get a return phone call on important information. Increased satisfaction is another benefit. The ability to share important health information among providers is another important benefit because it allows having immediate access to patient health information is more timely and reduces delays in care, and having to have patients repeat tests unnecessarily. Patients are able to check prescription information, request refills, and request appointments and office visits more easily through access to um, electronic health records and patient portals. And overall, doesn't it seem ridiculous in today's high-tech environment that patients have to jump through hoops to get access to information that should be readily available to them? Today, most people are accustomed to and comfortable with email, text messaging, and social media, and are able to access data on demand from almost anywhere on earth as long as they have internet access and a mobile device or computer. For example, most people have access to log into their financial institution website or child school portal. So why not their healthcare information? Apart from addressing the privacy and security concerns, patients should have more control of their own health data. As a means of accessing one's health information, a patient portal is a controlled and secure computerized pathway between a patient and the personal health information about the patient secured by a healthcare provider. As a consumer of healthcare, patients are able to play an active role by monitoring and evaluating their health status. It provides transparency and timely delivery of healthcare. Patients visit multiple providers due to the increasing incidences of chronic conditions and are able to recognize gaps in care coordination. Patients are able to engage in self-management, which can potentially improve healthcare outcomes. Patients' access to online health information through their provider's EHR system has grown significantly, moving from 26% in 2011 to 50% in 2014. As described by previous HHS Secretary Kathleen Sebelius, information such as lab results can empower patients to track their health progress, make decisions with their healthcare professionals, and adhere to important treatment plans. Based on research studies, diabetic patients using online patient portals were able to access appropriate education materials, laboratory results, and a messaging system to communicate with a diabetic specialist. As a result, when compared to non-users, a higher proportion of users achieved a reduction in their HbA1c levels by less than or equal to 7% at follow-up, resulting in improved glycemic control. My hope is that in the future, with innovations like interfaces and mobile apps, hopefully there is a promise that people will be able to seamlessly and securely access, use, and share their health information when and where they need it. Thank you.